of known faces in the audience, which is great. So it's a very familiar environment. I'm gonna, before I show you the dashboard, let me share my screen and start talking about what is the language of the dashboard. I'm gonna talk about how you can get your right industry and occupation, and I'll present the dashboard and with a few explanations. In addition to, um, let's get, I need to share this screen. All right. Can you all see the screen? Okay, perfect. So before I get to the dashboard, which is right here, and the dashboard, let me also share the link with you right now before we get further into it. It's housed on the DHS website, and you can just use the URL to get to it, or you use the AZ index, and it's workers' comp. Then you go to W, which is, and then Wisconsin Workers' Compensation Dashboard. So on this page, you can see the dashboard embedded in here, and some text to explain where the data is coming from, like Dr. McCoy just said, presented it. And we again some very sort of tutorial or manual, how to navigate, how to use the dashboard, using the overview, how to use the industry and occupation view, and how to use the cause of injury. What is it? What is it coming from? And all those languages, and how do we determine some of the metrics on the dashboard. So it's kind of, we want to make it a standalone dashboard so you can easily navigate on this tool. But to get started, the dashboard is fed by the workers' compensation data. And like it was said, we have claims that were reported to the Division of Workers' Compensation. So basically, an injured worker will file a claim to the insurance carrier, and the insurance carrier have some scenarios. They can deny the claim outright and say, this is not work related. So basically, those claims, most of the time, they are not reported to the Division of Workers' Comp. And the second scenario is, yes, this is a work-related claim, and it's subject to be reported. They'll report a claim, or the claim needs more information, and they also report the claim. So we don't have in here the medical claims, and we don't have claims that are outright denied by insurance carriers, which is important to put in context. Now, as environmental health specialists, we want to know our the right industry and the right occupation. So the NIOC, the National Institute of Occupational Safety and Health, which is part of CDC, has developed this very great tool that will help you get your industry and occupation. And the result is the standardized industry and occupation that everybody who work in industry and occupation data is able to understand. So let's just take a very basic and a simple example of industry that is public health. You work in public health administration or just public health, right? And then you are a sanitarian. So what is your industry? What is your standardized occupation? When you put those two, the industry and the occupation in here, you just click on get codes, will process it and give you this result. Usually you just stay with the first line. So you have the industry, which is Administration of Human Resources Program. This is the industry group under which public health is housed. So this is right, it's still public health. Public health will be just a detailed industry of this industry group. But you can see on the right-hand side, occupational health and safety specialists. So that's what your occupation is in terms of standardized occupation. And it starts with 19, which is the parent group of these occupations, and 19 is usually life, and I can show you life, physical, and social science occupations. So This is where sanitarian occupation is in terms of standardized occupation. It has some importance that we'll talk about in a minute. Now let's talk about the dashboard. So this is a Wisconsin adult workers' compensation dashboard. That means we are not showing teen, teen workers age 12 to 17. We are not showing any other age worker injury on this dashboard. What we are showing here is from age 18 all the way up to 65 and above. Is a 4-page dashboard. So we have this landing page, you have the claims by industry sector, we have the occupation page, and then you have the cause of injury by industry and occupation page. So we have 4 pages to navigate. Right away, you can see we have some graphs, we have some text, we have some big numbers, but I can tell you most of the things, visualizations on this page, whether it's a bar graph, it's a pie chart, it's a table, they are mostly filters and V's by themselves. We start with the year, the annual claim rate, to show the distribution, the general trend. If you look at all those 11 bar graphs, you can see how the claim rate has evolved from 2010 to 2021. And we did it on purpose so you can see that in terms of worker injury, is going slowly down. So that's the downtrend. And we want to focus on the most recent year when we pull the data, which was 2021. And it's the moment to say that we are working on updating the dashboard and we'll be adding a few more years to it. And knowing that is not realistic at this time to have an up-to-date real-time workers' comp dashboard, but we are working to have it updated regularly. So in 2021, which is the most recent year on this dashboard, we have 26,775 claims. So you can see the number of claims, the number of injured workers, the number of deaths in this specific year, and it's 38 work-related deaths. Now, this has to be clarified because it's not any time there is a death on a work site that the death is work-related. Death can occur at a work site and may not be work-related. So there is a team at the Department of Workforce Development that made the assessment and give us the data and say, well, this is the number of work-related deaths that we have in that given year. We talk about lost time due to the injuries, and that's the cost in the year 2021, about $97 million. Now, sometimes, let's say you got some injury. Let's say your finger was crushed or something happened and you ended up having a permanent partial or a permanent total disability. It has a cost. So for the year 2021, the permanent partial disability cost roughly 37 or $36 million. We have $106,000 for the permanent, and then we have other indemnities that are not all these three, including death benefit. Of course, death occur, so death benefit has to be paid, and it's about $1.2 million. We also have a pie chart here on the top that shows the distribution of claims, whether they were paid, denied, or no lost time. So 72% of the claim were paid in 2021, 21% were denied, and then 6% were considered no lost time. That means between the injury and the return to work, it was 3 days. We also have the distribution of those claims by age and sex. And you can see that, like I said previously, everything here is a filter. You can just want to see the distribution of claims by just paid claims. It will automatically update the dashboard. You can just click back on it. It will reset it. You can just be interested with any given year, and you will see the filter working across the whole page. Now, I do have a question to the audience. As environmental health specialist or sanitarian, what usually happens? I have my idea, but I need to ask, what are the injuries? Let's use the chart for a minute. What are the injuries that you are exposed to or mostly happen in your occupation? When you go for inspection, when you go out for visit, what are the most frequent injuries? Okay, I'm seeing fall, slip, and trip. Anything else from the audience? We see chicken flow, that will be slipping through. Car accident. All right, I think responses are coming. Let's get to it. Now, okay, then we have something. Let's just say fall, cause of injury, fall, slip, or trip. Let's select that injury and see how is it happening across the state. So for the year 2021, we have 1,760 fall, slip, and trip injury reported by 1,400 workers that accounted for $10 million in terms of lost time and $3.5 million in permanent partial disability. No death has occurred in that specific year, and the body part that are affected when fall, slip, or trip happen is knee. It's the first one. Multiple body part could be injured, and we have shoulder injuries and ankle and lower back. And in terms of nature of injuries, we have strain, fracture, contusion, sprain, or tears. Again, at this point, it's not specifically tied to your occupation, but it helps you have a global view of the burden of this specific injury. And you can do that across all other injuries that we have here. Let's go through this one, cause of injury by industry and occupation. So this is a page that will show you what are the injuries, like the question I asked you, what are the injuries that happen to any given industry or occupation and occupation? So let's say we talk about it already. Sanitarian will fall under public health. Public health, that will be public administration. And then the occupation, like we said, is life, physical, and social science occupations. So these, according to the workers' compensation data, they are the different causes of injury that happen during the year 2021 to sanitarian, generally, the big family. Strain, lifting, pushing, pulling, motor vehicle, I've seen car accident in the chat. But sometimes sanitarian can say, well, I work in healthcare. Healthcare and social assistance is also one of the industries. And then you have this strain, lifting, again, the same from liquid and greasy spill, exactly like I saw in the chat. So these are the common causes of injuries among this specific occupation. And you can come and you can look at other industries and look at other occupations. This filter can allow multiple industries, multiple occupations. We can go back on the home page or go back in the industry, claim by industry sector. This page will tell you what are the claims, what will show you what are the industries that are most hazardous in terms of injuries and how many, and what is the big family, and what is the trend. Basically, along with the claim count, the trend is going down. If we go from 2010 to 2021, we have a downtrend, which is good. On this graph, the bubble graph, we can see that we have the claim rate and the number of claim. So on the x-axis, we have the claim rate per 1,000 full-time equivalent, and the y-axis, we have the number of claims. The industry with the highest claim rate is wholesale trade, followed by transportation and warehousing. And then we can just go through all of them. Public administration, under which environmental and occupational health specialists that fall under, is this one, public administration, and is the third one in terms of claim rate. But again, there are a lot of workers under this. In terms of claim count, we have manufacturing workers. They have the highest claim count, and the top 5 or top 10 industries with the highest claim rate. What is interesting, if you click on each of those bubbles, let's click on public health administration. At the bottom, you will see the detailed industries. Now you see the third one is administration of public health programs. So yes, that's specifically public health, and is the third industry within the public health administration that has the highest claim count. You can see that that's pretty shocking to see. And we can do the same exercise with occupation. The same bubble chart with different numbers. We have the claim rate on the x-axis and the number of claim on the y-axis. The occupation with the highest claim count and claim rate is transportation, followed by production. And we can go down the road until we get here to physical and social science occupations, under which environmental and environmental health specialists fall. And if you do that, you'll see again the detailed occupations: agricultural workers, life, physical, social science technician, and then you see all the way down. If we apply data suppression rules, you cannot see anything less than 5 on these bar graphs. Interestingly, we can also see that the trend of claim, or the claim rate trend within this specific occupation, and from 2010 to 2021. It does not go straight down, but generally speaking, the trend is a downtrend with some peak in 2013 and 2014. So this is a very, again, we can spend a lot of time going through the different filters based on your needs, but this is a very high level kind of walkthrough of the dashboard. And I'm going to stop here and allow discussions with the team. Thank you.
Does anyone want to come off of mute and ask any questions, or you can put it in the chat if you'd like to? One of the things that I was thinking of is how you're able to filter it by the different industries. So I did see grocery stores was listed on there. And so just kind of thinking of maybe our food service industry, of how different their claims are from our claims. And it's just another way for us to be able to relate to our operators a little bit more too.
Thank you, Diana. This is a great question. How were we able to filter by industries? It was one of the beauty of this work. But again, the main data, which is the workers' compensation data, did provide us with the industry code of the employer. So we are able to, of course, do some additional cleaning, but it was already in the data. So we just use the global dictionary of industries to bring them together.
All right. Well, we are at about 9 o'clock. Do we have any other questions? Okay, I'm not seeing any come in or anyone looking like they're typing away there. So I just wanted to say thank you guys so much. It was a pleasure having you guys. That's a tool that I didn't really know existed until shortly before this webinar. So it's a really cool tool to be able to, play around with, and hopefully we can see a lot more use out of it in the future too.
Thank you. Thank you so much. And just
And
to
I
put the plug, we
Yep,
have
I see
several.
that Kate just put in the website for any questions. So if you guys do have any questions, just make sure that you save that chat.
Yeah, and this will, and again, thank you again for presenting. This will be on our YouTube channel. We'll send that link's on the invite for those of you that are here. If you pass that along to others that may have missed this. And then look for an announcement for next month. I'm trying to get Jane from DSPS for a quick tattoo body art piercing update. But otherwise, it looks like no more questions. Thank you both for presenting and today.
Thank you. Thank you so much.
Thank you. And please do reach out if you have any questions after the call.